Syphilis. It's a word that carries weight. This sexually transmitted infection has been around for centuries, impacting lives. But despite its long presence, many people still lack a clear understanding of syphilis, its causes, its progression, and the potential consequences if left untreated. This video aims to explain syphilis, providing clear and concise information about this complex infection. We'll talk about its causes and explore the various stages of the disease, shedding light on the symptoms that manifest at each phase. We'll also examine the methods used to diagnose syphilis and discuss available treatment options. Knowledge is power, especially when it comes to our health. By understanding syphilis, we empower ourselves to make informed decisions about our sexual health and well-being. Syphilis is caused by a tiny bacterium called Treponema pallidum. This bacterium is a master of disguise, often entering the body unnoticed and remaining undetected until it has firmly established itself. The primary mode of transmission is through direct contact with a syphilis sore, known as a chancre. These sores can appear on the genitals, inside the vagina or rectum, or even in the mouth or on the lips. Because chancres are often painless, they can easily go unnoticed, increasing the risk of transmitting the infection. Syphilis can also be spread through other forms of intimate contact, such as kissing, if a sore is present in the mouth. Even if a sore is not visible, transmission can still occur, especially in the early stages of infection. Understanding how syphilis is transmitted is crucial for prevention. By practicing safe sex, such as using condoms consistently and correctly, we significantly reduce the risk of contracting or spreading syphilis. Remember, knowledge is the first line of defense. Syphilis progresses in stages, each with distinct symptoms. Primary syphilis starts with a chancre, a small painless sore. Chancres heal within weeks, but the infection remains. Without treatment, syphilis progresses to secondary stage. Secondary syphilis features a rash on palms and soles. Other symptoms include fever, swollen lymph nodes, and fatigue. Section 4. The stages of syphilis. Continued latent and tertiary stages. As the infection progresses, it enters a phase known as latent syphilis. During this stage, there are no noticeable symptoms, but the bacteria remain in the body. The latent stage can last for years without any signs. If untreated, it can progress to the tertiary stage, causing severe damage. Tertiary syphilis affects multiple organs and can be fatal. Early detection and treatment are very important. Section 5. Unmasking the intruder. Diagnosing syphilis. Diagnosing syphilis is important to prevent long-term health complications. Blood tests detect antibodies produced in response to the infection. These antibodies can be detected for years. Blood tests are RPR test, VDRL test, and TPHA test. Talk to your doctor if you suspect exposure. Section 6. Combating the infection, treatment and prevention. The good news is that syphilis in its early stages is easily treatable with antibiotics. Penicillin, usually administered as an injection, is the most effective treatment. The dosage and duration of treatment will depend on the stage of the infection and the individual's overall health. After treatment, you have to follow up with your doctor to ensure the infection has cleared. This typically involves additional blood tests at specific intervals. It's also important to avoid sexual contact until you and your partner have completed treatment. Preventing syphilis is just as important as seeking treatment. Using condoms consistently and correctly during sexual activity is one of the most effective ways to reduce the risk of contracting STIs, including syphilis. Regular testing is also vital, especially for individuals who are sexually active with multiple partners. Early detection through testing allows for prompt treatment and reduces the risk of transmitting the infection to others. Section 7. Conclusion. Syphilis is a complex and often misunderstood infection with the potential for serious health consequences if left untreated. By understanding its causes, symptoms, and stages, we can take proactive steps to protect ourselves and our partners. Early detection through testing and timely treatment with antibiotics are crucial for preventing the progression of syphilis and its complications. Remember, syphilis is treatable and preventable. By staying informed, practicing safe sex, and seeking medical attention when needed, we can control the narrative surrounding syphilis and prioritize our sexual health. Let's break down the stigma, open up the lines of communication, and work together to create a future where syphilis is no longer a threat to our well-being.